Hi, my name's Estelle James. I'm a community health worker for Tidal Health in Salisbury. I work in population health. We try to get them back into the community by doing things on their own or finding the resources to help them. Seeing this job opening, I applied, and it's right in the line of what I do. I help people anyway, so it's better. I give back more now than just helping people take care of. I was taking care of patients before, but I take care of them in a different way now. My path started as a certified nurse's assistant. Now I'm a community health worker. I love my job because I love helping people.
As a care coordination specialist, I work primarily in the primary care offices. A patient's health journey really begins when they see the doctor. They might go home and need education on when to take medications, how to take them, why they're taking them, how to manage a certain disease, something like diabetes, congestive heart failure. There's all these questions that come up after you see the doctor, so I'm here as a resource to help you manage a long-term condition, to avoid going to the hospital or having to go to the emergency room. I'm also here to connect you with resources in the community. If you find that medications are expensive, if you need transportation to an appointment, I'm here to connect you with all of the resources and really empower you to take control of your health, even if you are managing a long-term disease. My degree is in biology. I've got my Bachelor of Science. I was a pre-med track, and as I went into the workforce, I found that there's a lot to medicine beyond practicing as a doctor, as a nurse, and as I began exploring those options, I found a care coordination specialist. I love that I get to empower people to really take control of their health, and seeing them hit goals, seeing them the light go off that they can take control and they're not at the mercy of a long-term condition. My name is Katie. I'm a care coordination specialist with Tidal Health.
Hi, my name is Bonnie Willie, and I'm the community social worker for population health at Tidal Health Peninsula Regional. I graduated at Salisbury University after 4 years with a bachelor in social work degree. The biggest part of what we do in our unit as 3 community health workers and myself is to help patients in the community with social determinants of health. The idea if we can help them in the community to meet some of those needs, which I'm going to go over, that it helps them hopefully reduce the need to have to come back into the hospital. Some social determinants of health that we work with include financial assistance. That's when we go out and help the patient apply for medical assistance or disability, etc. It's all about hooking the patients up to community resources. We also offer them medication assistance. There's so many people that can't afford their medications. Food is another big issue. So what we do is we purchase meal bags through MAC, and for those who have severe food insecurities, we take the meal bags to try to help give them some food in the interim while we help them apply for food stamps and give them food pantry lists. Our patients' needs are as individual as they are. So it's always a challenge when you go out. You never know what you might need, how we might help, but we're up for the challenge. We have 3 wonderful community health workers, and it's a great opportunity to not only help the patient, but watch them succeed, and most of the time learn how to help themselves, and certainly with the goal that they don't have to come back and forth to the ED if we can help them get some of these social determinants of health met in the community. I've been doing this for 36 years. I always feel like whatever I'm able to do or help that patient with, at the same time, I find an equal amount of fulfillment in doing it, and sometimes even maybe a little more. There is a lot of opportunities, especially in population health. I believe that community health workers, as long as I've been in this business, not until the last several years had actually even heard of the term. So I think this is the trend, the coming trend of where we're going. with population health. Community health workers are a huge part of it. The whole purpose of that is because the patients can relate to them. There's somebody that's out in the community regularly. They join with the resources that's out there. So if you have any kind of desire to help people, I think it's an up and coming path.
So I manage 3 school-based wellness centers, and I'm also the nurse practitioner at one of them. And what school-based wellness centers are they're basically, in addition to school nurses, which we have at all our schools, we have the wellness centers, and the wellness centers offer a variety of health services. We have a nutritionist that comes in, and she will see students who are interested in nutritional counseling, or if they want to lose weight, or if they're diabetic, or maybe even some of them need to gain weight. So we have a nutritionist that comes in to see our students. We have counselors in all of our centers. The counselors can help the students in crisis management. They can help them with things like study habits. They can help them with boyfriend-girlfriend problems, which we run into a lot. They cover any kind of behavioral or emotional needs. They also help with substance abuse, smoking cessation, all sorts of things of that nature. And we have nurse practitioners in all 3 of our sites, and the nurse practitioners offer medical services. We do physicals, both sports physicals, school physicals, job physicals. We provide immunizations to students that need them. We see kids who are sick in the school, so maybe they come in and they have a sore throat, and it was a day when mom or dad couldn't get them out to their regular doctor. We're able to do like strep screens. We're able to provide prescriptions. Now we do all of this with the parent's consent, because we have a parent decide whether they want their student to be allowed to come to the center or not. And if they choose to come to the center, which services they'd like them to have. And so we try to work closely with the parents. We also try to work very closely with our school nurses and with our guidance counselors. And we have very much of a team effort among all of that group, as well as school administration. I started out as a nursing student at Salisbury University. And during the time I was a nursing student, I really fell in love with pediatric nursing. And I decided that's what I wanted to do. So when I first got out of school, it was very difficult. It's a small area, so it was very difficult to get a job in that area. But then I eventually got into pediatric nursing within a year of graduation and met a couple people that were pediatric nurse practitioners. It was a very new field at the time. And I got excited about what they did, because they were able to take nursing, which is where I was, and take it another couple steps forward. So not only could you provide all the nursing skills that we've all learned, but then you could also do diagnosis and treatment and help the students or help the children even go further than I could as a nurse. So I think it's been a really great path, because I started out as a nurse. I became a pediatric nurse practitioner. I eventually went back to school again as a family nurse practitioner. So now I have the ability to see all age groups. I love my job because I love working with young people. Young people are our future, and every day is a joy because they always bring me something new to think about. I'm always learning. My name's Cindy Madden. I'm a nurse practitioner, and I'm the program manager for Tidal Health School-Based Wellness Centers.